Morning.
Morning.
All right. Thank you, Abigail, for sharing your story. So my name is Patrick, Minnesota Coalition for the Homeless. I'm going to focus on the Health and Human Service budget. There's going to be lots and lots of numbers, and I'm sorry for that. But it is important, and I'm so glad that I get to come after Abigail. At the Capitol, there's just endless spreadsheets and program names and acronyms, and it's easy to lose sight of the people behind them. But for all of this stuff that we're talking about today, it is the mom who wakes up every single morning and takes 3 buses, drop her kids off at childcare, and then another couple buses to go work her low-paying job, and then pay 70% of her income towards her rent. It is a military veteran who's sleeping under a bridge, dealing with serious mental health issues. It is the student at Metro State who sleeps in her car every night. So the Health and Human Service budget is almost $11 billion that we spend for every 2 years, and so we're putting together this budget, and the state is going to start spending it on July 1st, and so that's the time crunch. It's the second largest budget next to K-12 education, and it focuses on healthcare, services for people with disability, low-income folks, long-term long-term care, nursing homes, things like that, all kind of crucial, important things. So the House and the Senate have just passed their Health and Human Service bills that spend all this money and make some pretty big cuts, about $1.7 billion out of the general fund. And the governor, in his budget, cuts about $800 million for the 2 years. A lot of the cost savings are kind of built upon money that there's a discussion right now of whether it's real money or not. They're talking a lot about these waivers. We want to ask the federal government to say, will you allow us to change our services with the money that you give us? And almost certainly they're going to say no. And so we're kind of waiting for the other shoe to drop on that and where the rest of the cuts will come from, or if we have to, or if we'll look at raising revenue. So the 4 things that we're really focusing on: healthcare, mental health, general assistance, which is a cash program for very, very poor and sick single adults, and MFIP, which is our welfare work program for families. Those take some of the biggest cuts for us. Healthcare. People remember the governor signed the early MA expansion in his first or second day. Brought 100,000 people who make single adults who make under $8,000 a year. They're now on our Medicaid program. This budget would repeal that. 100,000 people would lose their health care. It would cost 20,000 private sector healthcare jobs, and the access in greater Minnesota for the program that they would replace it for would be almost nil. We know that this was kind of a project that we did before. A mom in Albert Lea drive to Duluth to pick up her very vulnerable son, drive down to North Memorial Hospital just outside of North Minneapolis, drive back to Duluth, drive back to Albert Lea. That was our healthcare system, and we're proposing to go back to that. Mental health, huge cuts in the Senate, $34 million. The majority of that is from children's health, mental health. There's a long list. Eliminates school-linked mental health services for children. That's about $10 million. It eliminates children's mental health screening grants. That's almost $8 million. Adult mental health crisis grants. It eliminates a whole bunch of programs. Income supports, general assistance. It's that very, very poor single adults, $203 a month is what they live off. They pay their rent. They buy their toilet paper. All of that. That would be eliminated and rolled into a block grant program. But the fact is, people wouldn't have their income anymore. With MFIP, the Welfare to Work program, there's a penalty if someone in the family is disabled and receives SSI. They would get a $150 penalty on their cash grant for every person in the family who's on disability. they really cap education and training opportunities for parents. That there's a 20-hour work requirement in MFIP, and they would say education and training doesn't count, and so you have to work, and then you can do that on top of it. And so, you know, we know that welfare to work needs to include training and education opportunities. And then in the House, there's they just passed a proposal that would make it a petty misdemeanor for anyone who uses their MFIP cash grant to buy alcohol and cigarettes, which, you know, like I personally think that's fine if we can find a way to limit that. It's very cynical to put a criminal charge on people when they give $430. I'd like to see the same limitations put on the corporate welfare and make sure that they're not buying any beer with it. I'm going to wrap up. There's lots of other cuts. Child care assistance takes deep cuts. This Children and Community Services grant has cut $22 million. That serves 430,000 people a year, dealing with abuse, neglect, poverty, disability, chronic health conditions. Community action councils, all state funding is eliminated in the Senate, and a lot of our homeless programs are administered through the 32 community action agencies across the state. So that's a little highlight reel of the proposals on the table. The good news is that they're proposals, and we have choices to make as a community about whether these are realized or not. As advocates, it's our job right now to talk about these cuts and connect it to the stories and the realities in the community, to make some noise. We kind of have an echo chamber at the Capitol right now, and we need to be out, and we need you talking to folks, and then we need to find solutions. For the Minnesota Coalition for the Homeless, we believe that revenue should be on the table and you know, as part of a balanced approach. So we have 5-6 weeks to go. Look forward to seeing you all down there real soon. Thanks for being here today.